Many healthcare organizations have a strategic priority to expand their telemedicine capabilities. And implementing the IT infrastructure to support that might sound straightforward until you see that there's use case requirements for remote patient monitoring, digital health coaching, mobile app integrations, chronic disease monitoring tools, and new video consult platforms. If you thought this is way more complex than you thought it was, it might be because people often use the terms telehealth and telemedicine interchangeably. In reality, they're two different things with two very different scopes of digital health delivery. In this video, we'll take a look at what the definitions are for both terms, as well as some of the things that will be considered for infrastructure, regulatory, and workflows. I'll try to keep things simple along the way and provide examples wherever I can to help clarify. Before we jump in, if you're new here, my name is Dre, a health IT consultant who's been working in the field for over 20 years, and also the founder of the Dragon Network, an online membership-based community for health IT professionals to share their ideas, experiences, and collaborate with one another on all things related to health IT. All right, let's jump in. We'll start with the definitions for both. Telemedicine refers specifically to clinical services being delivered remotely by licensed healthcare professionals. So think about a virtual visit with your primary care provider or a video call with an RN or nurse practitioner before you have surgery to go over the pre-surgical questionnaire. Another example of this would be a specialist that is consulting remotely to assess a patient for symptoms before they transfer them from a rural facility to an acute care facility in an urban center. The key to all of these is it focuses on direct patient-clinician interactions. Telehealth, on the other hand, is much broader and encompasses all sorts of digital health services. It does include telemedicine, but it also includes a bunch of other things like remote patient monitoring, digital health apps, digital therapeutics, wearables, patient education, patient portals, and the list goes on. Telemedicine projects can often leverage existing clinical applications or systems, and they're usually limited to service areas within the organization. They're going to focus heavily on clinical workflow and EHR integration, and while they may use mobile, tablet, desktop, or thin client devices, these are usually the same device types that are already leveraged within the organization for other applications. Another thing about the technical requirements for telemedicine is, although they may require additional expertise or resourcing, the build, training, and support are usually incorporated into existing health IT structures. When it comes to the IT component for telehealth, you usually have multiple different vendors with multiple different solutions, diverse data types, and integrations that may happen between clinical as well as non-clinical systems, depending on the particular use case. There may be much broader integration requirements, including with affiliate organizations or third-party vendors. This requires that IT architecture can integrate diverse data sources, be used across diverse device ecosystems, support multiple user types, and scale across many different service delivery models. They also may require entirely new platforms, data management strategies, and teams. When it comes to regulatory requirements, telemedicine falls under traditional medical practice regulations and requires the same privacy, security, and clinical documentation standards as in-person care. Details from a telemedicine encounter would also be included in the patient's legal medical record, and they would show up in the patient's visit history. Because telehealth encompasses such a wide range of scope, the compliance requirements can vary considerably. Some services may still fall under traditional medical practice regulations, but in general, when you're implementing telehealth projects, you'll need to take a closer look at the compliance requirements for each particular use case that's being implemented. For services that will include external organizations or community partners, there's also data sharing agreements and MOUs that would need to be considered. The next time you're in a meeting and people are talking about telehealth or telemedicine, listen carefully to what it is that they're describing, because like I said, people often use those two terms interchangeably, and they'll be saying one but describing the other. Are they talking about replacing in-person visits with video interactions between a patient and a clinician? Or are they envisioning more of a digital management solution with remote monitoring, patient engagement, population health analytics, and more? Understanding the differences between the two is going to help you ask better questions, make sure that the right people are at the table to have those discussions, and plan for a more successful project implementation. That's all we have for today. If you are finding videos like this helpful, please let me know by dropping a comment below or hitting that like button, and I will see you again next time.